Overdose deaths are due to struggles with opioid addiction by those who have received long-term prescriptions for the highly addictive drugs. Our state is among the top 10 states with the highest rate of opioid-related overdose deaths. And to learn more, we are talking with Dr. Craig Allen, the Vice President of Addiction Services for Hartford Healthcare. Doctor, thank you so much for being with us.
Thank you for having me on, Aaron.
So obviously this is a huge problem here in our state, really across the country. What is Connecticut doing to try and help end this opioid epidemic?
Yeah, it's a problem across the country, 30% increase over this last year, and even here in Connecticut, a 14% increase. A number of years ago, the state of Connecticut, the legislation put back into play the Alcohol, Drug, and Policy Council. And this is a body that is chaired by the Commissioner of the Department of Mental Health and Addiction Services and the Department of Child and Family Services, and it brings together people with lived experience and experts in the field to come up with ideas and strategies to try and decrease this harm that's come to our community.
I also have to imagine that with the pandemic and all of the different things that occurred over the last year and a half, was that part of a reason for an increase in these type of addiction struggles?
Yeah, that certainly added to it. You know, the opposite of addiction, people say, is connection. And connection was very difficult with quarantine and disruption of services, recovery services, treatment services, and harm reduction services. It's really important, gold standard, if you have an opioid use disorder, to be on an FDA-approved medication for opioid use disorder, like buprenorphine-based Suboxone or methadone. And if you're not ready for treatment, harm reduction is important. So naloxone, the opioid overdose reversal medication, it's important to get it out there. And the state of Connecticut has a Good Samaritan law. So if you give someone naloxone or if you call 911, you're not going to get into trouble.
I also want to ask you about, obviously, we have friends, family, loved ones. What are the things that we should be looking out for? And what do you do if you think someone may be in trouble?
Yeah. Well, you know, someone that is taking, let's say if it's an opioid analgesic medication, a pain medication, and they're taking it in other ways than it's prescribed by their doctor, that's a problem. If their behavior changes, if their motivation, their attitude, their mood, any of those things start to change, and the people they hang around with, things they used to like to do, they're not doing anymore, or they're getting into different kinds of trouble, making bad decisions, that can be that could be concerning, and that might be a sign that they've developed an opioid use disorder.
Well, you are a wealth of knowledge on this very important topic. Dr. Craig Allen, thank you so much for being with us.
Thank you for having me.